My name is Chuck Leonard, and I'm here to introduce you to a new technology, the Myotonometer, which is a device that quickly quantifies muscle tone, muscle strength, and various protocols can quantify other things such as the level of severity of spastic paresis. The development of the Myotonometer, or the device that ultimately would be called the Myotonometer, actually began back with the Russian aerospace industry, where engineers and scientists were attempting to develop a device that would be able to quantify changes to muscle health associated with prolonged exposure to microgravity environments. I became involved in the project back in 1993, where as a neuroscientist and physical therapist, I saw the potential of the device to be developed into something that could quantify muscle tone, muscle strength, and spastic paresis. Currently, NASA scientists are using the Myotonometer to assess muscle health during prolonged exposure to microgravities. The need to quantify muscle tone and muscle strength extends across many disciplines, including sports medicine, athletic training, physical therapy, industrial medicine, neurology, restorative neurology, and fitness. The Myotonometer was developed to bridge the gap between the scientific community and the clinical community. We have had scientific laboratory methodologies to quantify tone and strength, but these have had limited clinical use secondary to their complexity and the time-consuming nature of their procedures. Clinical tests that have been typically used, such as manual muscle testing, Ashworth scales, Tardo scale, and functional outcome measures, are also of limited use, secondary to reliability issues and their inability to quantify change. In some settings, insurance limitations and capitations have limited the time a clinician can spend with a patient. Therefore, more time is spent and needs to be spent in treatment rather than complex assessment procedures. However, clinicians are increasingly being asked to provide evidence of their interventions, i.e. evidence-based practice. Therefore, there is a need to develop an instrument that could quickly and precisely quantify these measures. Other professionals outside the medical arena also have a need to quantify different muscle characteristics. For instance, athletic trainers are increasingly asked to prove the efficacy of their interventions to show how durable an athlete is and whether that athlete is capable of returning to competition without risk of further injury. Athletes are also looking for methodologies that will help them increasingly focus their strength training and their fitness regimens. Data obtained at rest measure resting muscle tone or stiffness. Data obtained during a muscle contraction provide an indirect measure of muscle strength. This is possible because muscle stiffness is directly proportional to its level of activation and torque production. Published studies have shown strong correlation among myotonometer measurements, surface electromyography, and joint torque production.
The Myotonometer is FDA approved. There are CPT codes for reimbursement available for the use of the Myotonometer as an assessment tool. There are also CPT codes for the use of the Myotonometer as a treatment tool. In addition, the Myotonometer can be used for neuromuscular re-education and biofeedback. Neurogenic Technologies are the exclusive licensee and the sole distributor of the Myotonometer.